name's Claude Hemphill, and I'm the Chief of Neurology here at San Francisco General Hospital and Director of Neurocritical Care. And on this World Coma Day, I wanted to tell you a little bit about the Coma Cohort study. The Coma Cohort study is a study that we started in 2023 at San Francisco General Hospital and UCSF because we really recognized that we had a lack of information on how common coma is, the specific neurological causes of coma, and specifically and especially the trajectory of recovery of our patients.
Hi, I'm Kate. I'm the primary coordinator for the Coma Cohort study.
Hi, I'm Derby. I'm another coordinator on the Coma Cohort study.
I'm going to give you a couple more details on what the Coma Cohort study actually is. So it's a long-term observational study where we enroll patients who were comatose from a neurological injury. So that could be something like a traumatic brain injury, cardiac arrest, even meningitis, a bleeding stroke in the brain, many different causes. So what we do is we enroll you in the study when you're in the hospital, and then we keep an eye on you throughout your hospitalization and follow up every couple of months to see how you're doing.
We also collect information about social determinants of health. This is an innovative part of our study where we're asking about things like access to food, access to housing, income status, and medical insurance. The goal of this is to better understand how these factors may better contribute to a patient's recovery after being hospitalized in a coma.
As Dr. Hemphill mentioned, we've been developing this study for over 2 years, and we currently have over 330 patients enrolled. This is where Derby and I do our consent calls to see if patients would like to participate in the studies, where we do our follow-ups, data entry, and just general project development. But come with me, I want to show you one of our favorite spots to collaborate for the Coma Cohort study. My favorite part of being a coordinator for the Coma Cohort study is the amount that I get to be in the hospital with our patients and families. I recognize that to be in the study means that families are going through a particularly challenging time. So for us to be able to be in the hospital with them and form connections that hopefully last for months to come, that's something I'm really grateful for, and I'm looking forward to continuing to be able to connect with patients and families in this way.
The best part to me about being a coordinator on the Coma Cohort study is forming connections with the families during the follow-up calls. I really enjoy speaking to the patients and their family members and hearing about the recovery and the challenges that may come along with it. Whether it's the first month or a year down the road, it's really great to hear from everyone and spend 20 minutes on the phone connecting with them and appreciating what may influence their recovery.
Well, I'm grateful that you're part of World Coma Day and the Curing Coma Campaign. If you're watching, then you're participating in our efforts together to improve the care of patients with disorders of consciousness and to cure coma. Together, we're going to improve the understanding of how our patients do and what we can do to improve their outcomes, both in the hospital setting and throughout their pace of recovery.
Let's cure coma together.
Let's cure coma together.
Let's cure coma together.